For my wonderful introduction. Thank you very much. So let's start our subject. Uh, so CBME as the curriculum, this competency-based Ayurveda education and curriculum comes. So everyone among us and every faculty members has so much confusions, how to implement, how to assess all those things. But basically when we see the change is the nature of law, and unless and until it doesn't change, the Ayurveda education doesn't upgrade it. So look, when we look behind our traditional curriculum, and there are so many extension of the institution, but when we look to the qualitative educations, we saw that the whatever the Ayurveda graduates coming from that institution is not so much confident, is not compassionate. They are not skillful in it. They are hesitate to try the Ayurvedic practice. In Maharashtra, most of the Ayurvedic practitioners do the more allopathic practice, turns to the allopathic practice. Why this scenario? When we teach the Ayurveda education is not up to that extent, up to that levels that our graduates becomes confident to do the practice. Even the small surgical skills or a small casualty procedure, they are not handling this. Even the Panchakarma, simple Panchakarma procedure, Rakta Moksha, they are not competent to do that procedures. Why? And that's why our apical council has decided to reform the Ayurvedic education. The traditional education is the vast one, and we are doing the only, there is the educational objective, and that we are going to, at the end of the course, we are going to assist the students. But now there is the need to upgrade our curriculum, our educations as per the societal need, as per the regional need, as per the national and international health needs. Because most of the Ayurveda graduates, after the taking the degree, they maybe go to the abroad for practicing. And if from such a scenario, our graduate is not competent to do all those things, so I think there is a need to of the performing of CBME, and looking towards this, on the 16th February of 2022, our Apical Council has launched the competency-based Ayurveda education. So today's objective, my topic is regarding the assessment. I'm one of the member of curricular committee, and I have seen as an expert of health professional education, I have looking towards this assessment and evaluation process. So objective of today's lectures is that to understand the role of assessment. What is the role of assessment in this competency-based curriculum? What's the difference between the traditional assessment system and competency-based assessment? And what are the changes as per new competency-based curriculum? What are the components of the assessment? And what assessment tools we have to be incorporated within this curriculum? And last one, that is the making the blueprint and question paper template, how that templates or question paper is to be framed. So why to assess? When we see the teaching and learning education process, there are the three basic pillars of that education process. And that pillars are learning objective, teaching learning methodology, and assessment and evaluation system. Learning objective, when we teach any topic to the students, that learning objectives must be the specific, that must be the measurable. And that's why in our each topic, we are framing the learning objective. And for that, whether that learning objective, how to incorporate that learning objective, and there are different teaching learning methodologies is adopted. We call it as the instructional methodologies. And after that, the assessment and evaluation. unless we doesn't assess the student, we doesn't know whether he is the competent, whether he or she is the competent in that field, whether they grasp that learning objective or not. So assessment is the vital for the development of the competency. Assessment ensures the learner whether he is competent to performing the practice or to his is as a role as a physician in the society. So there is, and whether he achieved the minimum set of standards of practice as per given by our councils. When we see to the traditional curriculum and today's competency-based curriculum, what is the basic difference in that curriculum? Previously, the traditional curriculum is the subjective nature. More emphasis is given on the knowledge. स्टूडेंट ने ये जानना चाहिए, स्टूडेंट को ये पता होना चाहिए, स्नेक के इतने टाइप्स है, विषों के इतने टाइप्स बताए हैं. That more is emphasis on the knowledge. And last, we conduct the exam at the end of the course. That is more is the summative one. It is the norm reference. So that is not so much reliable. Here during this process, we assess the competency of the student at the end of the session. So that's why there is no scope of feedback. With what is student may gain the learning or not. But now the competency-based education is the most integrated part. There is the integration of all the subjects, all the competency in that. It is mostly of the formative area. What is mean formative and summative? It is a criteria reference. And that assessment is not at the end of the session, but it is during the course session. And here, there is the feedback we can gain from the students. So, what is examination pattern? The Agad Tantra, in the recent curriculum, the Agad Tantra, that is paper 1, and the marks that is given is of total 300 marks. Theory component, when we see it is of 100 marks, and practical component is of 200 marks. Where that practical is also divided into the practicals, viva, electives, and internal assessments. So this is the basic structure of our assessment pattern in competency-based curriculum. So what is schema of assessment? Schema of assessment is the formative and the summative. Means in the 1.5 year course, 6 months is considered as the term session, and the term-wise examination is conducted. In the first term, we have to conduct the 3 periodic tests and the first term test. In the second session, again the 3 periodic test and second term test. And in the third, last 6 months, there is also the 3 periodic test and the university examination is given. So basically, what is meant by formative and summative? Formative is the assessment during the learning, and summative is at the end of the course that was given. So why this formative is important? Because formative learning is the help the learner and the teacher to know the progress of the students. When we teach any, means in the first term, there is a Disha Chikitsa Upakrama. We have taught that subject to the students. But if the summative type of assessment is there, we doesn't know whether after the teaching that topics, student has gained that competency to perform the treatment of the poisoning patient or not. We doesn't give the feedback from the students. But during the formative assessment, what happens? After the completion of that topics, we are assessing the students. And if their After the assessment, we know that if there is certain weakness in the students, so that, and there is weakness in our teaching also. So we are try to expand it. We are trying to change our teaching methodologies. So this is the advantage of the formative assessment. And summative assessment, which is really that is a course completion. Now, what to assess? Assessment is basically for the role, know the domain of competencies required to practice as a physician. There are three domains basically that are cognitive, affective, and psychomotor domain. Cognitive domain is related with the knowledge, whether that student has gained the knowledge of that particular subject. Affective domain is related with the attitude. After teaching that topics, what attitude is gained by the students is cleared by the affective domain we are testing. And then psychomotor domain, that is the practical skill. Whether student has performed well, whether he is doing his case study or any gastric lavage practice or RT insertion practice. So that we are evaluated in the psychomotor skill, that is the now the cognitive domain. Here is the Bloom's taxonomy is given. Bloom's taxonomy is for the assessment of the cognitive domain, and that given knowledge, we are measuring the knowledge, then the comprehension, the application, its analysis, synthesis, and evaluation. So what is the knowledge? Knowledge means just recalling or remembering and recognizing. Means when we give the definition of Visha to the students, and when we ask about write down the definition of Visha as per the different Acharya, what here we are, the students are only recalling that subject. If we ask in that he enlists the types of neurotoxic poisons or enlists the types of the Visha. So what? He is only memorizing the things. Okay. So memorizing and identifying the facts without asking beyond. That is known as the knowledge-based questions. Okay. When we are testing the cognitive domain, in the UG level, the knowledge domain, comprehension, application. This domain is very essential. So comprehension means how the subject is elaborated. Description and explanation when we are asking, then it is known as the comprehension of the. For example, if we ask the students that describe the procedure of the gastric lavage, or describe the sign and symptoms of the poisoning, or explain the vague-wise symptoms of the snake bite, all these are related with the comprehension. Means we are elaborating the facts. That is known as the comprehension. Application. मान लीजिए हम we are describe any one concept in the, for example, the Garavisha and Dushivisha. So Garavish and Dushivish, this concept, how you apply in your life, in your day-to-day practice, or in terms of dermatological manifestation, or in terms of the food poisoning. So here, whatever the concept we are teaching to the students, that was how the application of that concept in the current scenario. And for that, like the example, we have to ask the questions like the apply concept of the Dushivisha or Garavisha, like. Then analysis. Analysis, certain concept of the description of the certain concept, the breaking down that concepts. For example, in the 24 Upakrama, there is a Hrudayavaran Chikitsa. So, Hrudayavaran Chikitsa, why it is important? How it can correlate with the current scenario. So, analyze the, if we give one of the phrase and ask the student about the analysis this concept or analyze this shloka in the current scenario. So that types of the reasoning, we are asking the reasoning or breaking the material into the parts and its relationship to each of the part. Now the synthesis. After the analysis, the fifth one is the for cognitive domain assessment is the synthesis. Synthesis means creating or putting together the parts, all the elements in one form. When we ask the students about any poisoning case or description of the any poisonous compound or organized phosphorus compound scenario is given to the students. So in that case, the particular sign and symptoms you have to be mentioned and then ask the students to propose the treatment modalities or propose a plan of treatment in certain such and such scenario. Here I have give the example like the 46 years old patient admitted in the hospital and he's complaining of the pain in the abdomen, stiffness in the muscles with typical clonic tonic convulsions and with dilated pupils. Here we are giving the clue that specific symptoms is given in which type of poisoning. We have already teach in the theory classes or practical classes or whatever the teaching methodology we are adopted, we have given to students. And in certain framing of the questions, the students need synthesize all the symptoms and then try to diagnose it. What type of case scenario is that and what line of treatment is to be used in certain cases. Means only recalling is not there, but creating or synthesizing all the material is the such type of scenario we called it as the problem-based learning. Then the evaluation. Evaluation that judging the values of ideas, methods, materials or procedures. For example, a case is given to the student that a bloated dead body was found with greenish discoloration and foul smelling. Now, assess the condition of the body in details and how will you estimate the time since death. Here, we give the clue to the students that there is the greenish discoloration and foul smelling and bloated dead body. Student has to assess the condition, what it means, and after estimation of the time since death. Means how much time is after the death of that person. He has to. So such 6 types of label is essential for the assessment of the comprehension. So in short, the cognitive domain is the intellectual skill we are judging, and that is for there are 6 labels. That knowledge means remembering the information, comprehension that means understanding the meaning of that, application using that information in the current scenario, analysis breaking down that components into the parts, synthesis produces the new whole, and evaluation judgment. So after going through all these labels, there is not ki student only recall or memorizing the thing. After evaluating on this level, assessing the student on this level, student gets much more than beyond the knowledge. So this is the Miller's level of assessment. Means in the first level, students only knows. That knows factor we can assess by taking the MCQs, essay type questions, or by oral viva. What the fact the student is known. Knows how. Means here we are expecting the student describe that concept or applicability of that concept, and then it shows how the performance is assessed by some of the methods, that is OSCE, OSPE, or we can use the simulated patient-based teaching. And thus that means that he become the expert and performance assessment, and that is the higher level of the Miller's pyramid that he is doing. That skills independently. So when you are framing the questions, the question is framed in such a way that not only recalling pattern or not only memorizing the things, but is also the comprehending the things, and that student must get the understanding of those things. Here's some of the words that we can use for making the questions. Means for recalling the things, we can use the define, identify, underline, or enlist, or recall, recognize. Such a words you can use for framing your questions. And for the understanding or comprehension you want to ask the students, then here you can use the words like the compare, discriminate, choose, describe, determine, distinguish, explain, interpret, or illustrate. I think while framing the question, this is very important part. Application, knows and comprehension is mostly called as the level 1 questions. And when the concept is application or analyzing, then it is called as the level 2 questions. And for framing the level 2 questions, the words we are using like the apply, convert, demonstrate, estimate, extend, illustrate with an example certain things, or demonstrate how the adulteration will be in the milk is carried out, or analyzing, here the analysis of the concept or compare the two things, or determine, conclude, criticize. This word can be used for the framing of the question. So now there are different tools are using for the periodic assessment. Different tools is mentioned in our curriculums. Last page of curriculums, there are different tools there is given by. So basically, what tools, there are so many queries in the mind of faculty, what tools we are using and how it can be implemented, how it can be carried out. So looking towards the topic, in the I have mentioned some of the, say, in the first term, there are the topic like the concept of Agad Tantra, Visha Chikitsa, Vishakta Ahar Pariksha, Garavish, Dushivish, Visha Upadrav. forensic medicine, VAP-Sambhasha, legal procedure, and personal identity. Now, how you can evaluate or periodic test you can conduct on this topic, first topic. You can make the quiz questions, or you can take the open book test or MCQ based questions. There shloka recitation, because in the first term there is the concept of Agad Tantra. So under that basic concept, there are so many shlokas. So shloka recitation you can take. Then Garavisha, Dushivisha, this concept can be elaborated by the student by taking the debate competitions, and you can use the essay writing methods. Then VAP-Sambhasha, legal procedure, and personal identity. These are the topics. You can use the role play methods here. You can use some of the things like the consent, or how the declaration of death is going on, or what happens if the negligence occurs, or how the ethics is followed. So such scenario you have to frame and you have to implement it. So by this teaching methodologies, you can teach this topic by the role play method, or you can assess this topic by the role play method also. In the second term syllabus, when we look, there is the environmental toxicology, dermatological manifestation, therapeutic utility of Agad Yoga, Savar Vish, Jangam Vish, thanatology, asphyxial death, and injury. Here, mostly we see the dermatological manifestations and environmental toxicology. So you can make the poster competitions or report writing. If you take the industrial visit, so report writing can be, by report writing you can evaluate the students. Or now the 31st of May, there is the No Tobacco Day. In our department, we are also take the poster competition for that. So periodic assessment, by the periodic assessment, you are judging the students whether the topic is gained or not. And it is very easy, simple tools are these, whatever the tools we are described or we are written in the curriculum, that are very simple way we can take these evaluations. So let's go to our important topic, that is how the assessment is carried out. Is the screen is visible?
Yes, ma'am.
Yes, madam.
Okay. So periodic internal assessment, there is the internal assessment mark sheet is given, and that internal assessment is based on the periodical assessment, term assessment. I just want to share the one of the documents that I have made. Is this visible?
Yes, ma'am.
So here I have already applied the formulas that is given in there. So this is the combined internal assessment mark sheet. First term, second term, and third term. So now in the first term, the three periodic assessment here is. So if the student has gained the 12 marks in the first term, first periodic assessment. Okay. Then if he achieve 11 marks in the second periodic assessment, and then he achieved again the 12. So average of these three periodic assessment is comes 7.67. Okay. Then we have to reduce it to 30. So it is divided by 15 and multiplied by 30. So that comes the 15.33. So whatever the marks now gain in the first term assessment, if that student got out of 100, student got the 72 marks. Okay. And practical marks out of 100, he has scored 74 marks. Then, after converting this, we have to convert this 72 and 74 into the 30. And that is the 21.90. And then these marks, subtotal marks, is divided by the 60. We have to add these marks, then terms marks, conversion, and then these marks, subtotal marks. And it comes there about 22.62, means in the first term, the internal assessment that students scored is 22.62, that means 23. Got it? Like that, in the same way, we are doing the second term and third term. And then we have to take the average of these three terms examination marks, and it comes reduced to the 10. And it comes to the, then out of 10, it becomes the near about whatever it comes. Okay. So this is about the internal assessment mark sheet. Is the PPT is visible?
Yes, ma'am. Can you make it full screen, ma'am?
Yeah. Is it okay?
Yes, ma'am. Very much okay.
So next to our paper pattern, that is MCQ, SAQ and LAQ. And how that MCQ, SAQ and LAQ we have to ask on the basis of that labels, I have already explained. So number of questions is 20 MCQ, 8 SAQ and 4 LAQ. So marks per question this is, and overall paper weightage is the 100 marks. Now, let's look towards this weightage as per the theme. So many faculties have the queries regarding this, how that mass weightage is given. And why this theme is, I have mentioned here. Because we club the overall topics in our syllabus, we've seen that 23 topics. And we club these topics under the 9 themes. So why this is done? Because we have to framing the number of questions, and according to the weightage of that particular topic in the syllabus, we have to frame the LAQ also. So that's why from what topics or from which topic we can ask the LAQ, or we can ask the MCQ, or we can ask the SAQ, and that's why that similar topics we are clubbing here. So under the theme 1, we have add the concepts of Agad Tantra, Visha Chikitsa and Vishakta Ahar Pariksha. And total overall hours given to this topic, I think 23 hours is allotted to overall these topics. And that's why the 13 marks weightage is calculated here. On this topic, you can ask the MCQ on all 3 topics. You can ask the SAQ. But while framing the LAQ, on the Vishakta Ahar Pariksha or Viruddha, you don't ask the LAQ. The LAQ is mostly from the must-know area. Must-know area, that means the core competency. Must-know, our syllabus, when we see our syllabus, that is the 60, 30 and 10. 60 is the must-know part, 30 is the desirable to know parts, and 10 is the nice to know parts. So when we see the concepts of Agad Tantra and Visha Chikitsa, this is the core competency. And the 10 marks LAQ can be framed on these particular topics. That's why LAQ can be, you can ask the LAQ on this both topic. Then Garavisha, Dushivisha and Visha Upadrava. On this topic, 12 marks is allotted. And also here also you ask the LAQ on Garavisha and Dushivisha, not on the Visha Upadrava, because Visha Upadrava is not so much elaborated, and it is, I don't think at the UG level, this topic is, we have to given so much burden of such a topics. So limited description is there, and that's why no LAQ you have to frame on this Visha Upadrava and DC. Then under the theme 3, we are clubbing the environmental toxicology, dermatological manifestation, and therapeutic utility of Agada Yoga. So basically all these topic is not so much elaborated. Okay, we just want the students about it. Little bit description. Yeah, that means SAQ you can be asked. But the matter or content is not so much that you can ask the 10 marks question on this topic. So don't ask the LAQ on this topic. Then theme 4. Yes. As per the Visha Chikitsa, this theme 4 is very important because all the poisonous plant, metals, and Jangambish comes under this topic. And that's why the weightage given is the 17 marks. And on this topic, you can ask the LAQ. Then theme 5, here the Krutrim Visha, substance abuse and Agad Tantra perspective on cancer. Now, Krutrim Visha and substance abuse, under this, the topic is lengthy, Visha is described. So we can frame the LAQ. But Agad Tantra perspective, this is totally the new topics. And that's why I don't ask the LAQ on this topic. Then forensic medicine, Vaidya Sadhrutta, legal procedure and personal identity. Of course, the duties and responsibility is the MK, and must know area core competency that student must know. But don't ask the 10 marks. It doesn't want the given full weightage on that particular topic. So you can claim the MCQ and SAQ on this portion rather than the LAQ. Then theme 7, under the theme, this theme thanatology, asphyxial death and injury. This is also the important topic. And you can frame the MCQ, SAQ and LAQ on this topic. Now under the theme 8, we have taken the pregnancy, delivery, abortion and sexual offenses. So this is also the desirable to know and nice to know area. That's why no LAQ. You have to be asked on this topic. Then under the theme 9, the forensic psychiatry, forensic science lab and laws, acts various laws. So you can ask the SAQ and MCQ, but don't ask the LAQ, because we are not the legal expert that we are asking the students that elaborate this NDPS Act and elaborate Organ Transplantation Act. No, we are not the expert in that field. We just want to student know about this topic. So that's why the MCQ and SAQ can be framed in this topic. So when you want to framing the question paper, this is the primary template. You can prepare the paper accordingly, like the 4 LAQ and then 10 marks LAQ and total 40 marks SAQ, 5 marks SAQ and total SAQ is the 8 and then 40 marks and MCQ is of the 20 marks. Now in the LAQ, there is the level 1 and level 2. So 3 LAQ is of the level 1 and 1 LAQ is of the level 2. Though it is not mentioned in our curriculum, but now there is an exit exam. I think after the internship, there is an exit exam, and in that exit exam, the level 2 question can be asked. So we should prepare our students so that they can capable or competent to solve these level 2 questions also. So scenario based application, synthesis, evaluation type of questions you can ask in the level 2 group. Now this is the secondary template of the summative exam. So as this is elaboration how it prepared, the weightage given in the syllabus is the 23, and so percentage of syllabus in this is the 14.37, and that's why the 13 marks is given. 1 or 2 marks is थोड़े से इधर हो गए थोड़ा सा. Then here the Garavisha total weightage given in the syllabus 15 hours, and the percentage of weightage is 9.38. That's why 12 marks is given to this, and looking toward the importance of this subject in the current scenario, the 12 marks is given. So when we say that these are the 13 marks is given, so when we distribute these 13 marks, you can ask the LAQ on this topic. 10 marks LAQ, when we ask, then there is remaining of only 3 marks. So that on that 3 marks, you can ask the SAQ. Sorry, MCQ. On that 3 marks, you can ask MCQ. So overall, 13 marks weightage is completed here. Okay. Then, Garavisha and Dushivisha. Here, the 12 marks weightage is given. And 12 marks in this, as I have already asked 1 LAQ here. So, in this top, I have only asked the 2 SAQ. So 2 SAQ, so already 10 marks is here. So remaining 2 marks, I asked the 2 MCQ. Then environmental toxicology, looking towards this third thing, the weightage, that means the hours given is the 60. So overall weightage is 10%, and that's why the marks are attributed to this topic is 11 marks. And so that we can ask as some of the topics, it's therapeutic, dermatological manifestation or the therapeutic utility of Agad Tantra. Some of the topics is also covered under the decay area. That's why one SAQ is we have taken from the MK area, and one SAQ is from the decay area. So remaining 1 and 1, that's 10 marks is already. So we are only asking the 1 MCQ on this particular topic. Now on the fourth, here the total number of hours allotted is the 28 and the weightage is near about 18. And so that's marks allotted, this portion is 17 marks. And here, that's why the one LAQ is asked, and that is in the, under the MK area. So 10 marks is shifted to the for the LAQ. Then 5 marks, we are asking the one SAQ, and then remaining 2 marks on that MCQ is asked. The next theme, in this theme, the 15 hours is allotted, and the weightage given is near about 10%. And that's why mark given is that 12 marks is allotted this topic. And for that, we are here also we asked one LAQ, sorry, one SAQ, and here we are asking 7 MCQ. So distribution of mark is 12 is over. While calculating or while framing the question, you must take care that whether that is under MK, DK or NK area, and whether the mass distribution is right or there is excess one. Then the last, that is the theme number 6, sorry. The 23 hours is allotted, percentage of weightage given is 15 and the marks allotted is the 10 marks. And that's why we can ask one LAQ or 2 SAQ. Then this theme, we have given thanatology and injury 22 hours. Weightage given in the curriculum is 40 and the marks allotted is the 12. That's why we can ask one LAQ here and remaining 2 marks, we can ask the MCQ. As this pregnancy, delivery, abortion, weightage is least, 8 hours is given and the marks allotted, weightage is 5%, so marks allotted is 6. And that's why here we ask only one SAQ and one MCQ from the nice to know area. The last theme, that is forensic secretary, here the 10 marks is allotted. Sorry, 10 hours is given and the marks allotted is 7. So we ask one SAQ here and 2 MCQ. So overall, this didactic, that means didactic theoretical class, 160 hours is allotted and the weightage 100% and overall marks distribution is the 100 marks. So must know, this is the distribution that we have to ask the 15 MCQ from the must know area, or from 3 MCQ from the desirable to know area and 2 MCQ from the nice to know area. Like that, the short SAQ for SAQ, here is the must know area, the 7 SAQ, and from desirable to know, 1 SAQ. And LAQ, we have asked LAQ from the most of the must know area, and compulsory LAQ is from the must know area. No LAQ you can ask from the nice to know area or desirable to know area. So that's all about the summative blueprints. And I have also made the template for the term exam. Because in the term exam, the distribution of syllabus, the segmented forms, so this template is different from the template for using for the summative examination. Whatever the blueprint I have seen you, that in that you can make the changes also. But in this template, you can make the changes. But while making the changes, please marks given that keep in mind that no higher weightage or no less weightage is given to that particular topic. Means overall syllabus have to complete it in that question paper. And that's why we have different the blueprint and the templates according to that. All aspects, MK, DK, NK questions or all topics have to be covered. This is the secondary template for the term examination. And here the term examination, also the paper is of 100 marks. And all these are the themes that is for the term examination. So total near about 61 hours is for first term exam. And that's why the weightage mark distribution to this topic. First theme is the 38 and on second theme 24 marks and third theme is also the 38 marks. And here I have distributed this. So you have to ask the 4 LAQ. So here I have asked 3 LAQ on level 1, one from basic concept, one from the Revisha, and second and third one from the forensic medicine. And I have one more LAQ from this level of level 2 and this first thing. Then we have to ask 8 SAQ. So 8 SAQ that 5 from the 7 from the MK area and 1 from the DK. So 3 SAQ is asked on the basic concept, 2 from the Garavisha Dushavisha and 2 from the forensic medicine, and here from the DK area we have asked 1 SAQ. So total calculation is 8 SAQ, 4 LAQ, and here the MCQ we have framed. There is a, this is the competency number I have given according to the topic or according to the learning objective that is mentioned in our curriculum. So on 2.2, I have mentioned 1 MCQ, or 1.1 I have mentioned here. Then this 4 MCQ is from the Garavisha Dushavisha. Thoda incomplete reh gaya. Then 8 MCQ is from the MK domain, 3 from the DK, and 2 from the NK area. So all these 20 MCQ we have to be asked. So this is the secondary template for the first term examination. I hope this is helpful for you. So distribution of practical marks, all accordingly there's mention is our curriculum. This is spotting 60 marks practical record. So no need to explain this. This is already mentioned in syllabus. I don't think anyone have any queries regarding this. This is so many queries is regarding how much practical marks is allotted for the term exam. In the MSc, there is specifically mentioned the term exam practical is of the 100 marks. So under there is no fixed criteria ki you have to take this 60 marks, Viva is of 60 marks or Viva is of 40 marks. That is fixed, flexible according to you. Or means in your institutions, what is the equipments, what are the infrastructures, number of staffs available. According to your feasibility, you have to decide the heading of this practical examination for the term exam. So I have just made one sample copy for you. In the first term examination, when we see there is we don't study the about that Jangam Vish or Sthavar Vish. There is no Sthavar and Jangam Visha. So when we decide the spotting head आई थिंक ये आप लोग फर्स्ट टर्म में मत लीजिए. Rather than you have add the OSPI, CPR, gastric lavage. You have mentioned the case record. You have mentioned the adulteration test you have to be performed, certificate writing, and practical record. Under the second term, yes, there are so many Visha and you have teach the student about it. So that's why the spotting you can carry the 30 marks, practical records, 10 marks. Case scenario is also the dermatological manifestation. So you can give the student the case scenario and ask them about that. What is the diagnosis? Then therapeutic utility of Agada. You can, as the, it is in the second term topics. So you ask the student about, or you can place the number of herbs in front of them and mention what are the drugs or what are the herbs that is needed for the this type of agada, and what is the utility or indication of that agada or probable mode of action of that agada. So 10 marks you can ask there. In the third terms, so the practical record, case record, spotting you can mention, and viva. So all these are about the sample copy I have given you for the term test. So all these are about the assessment and evaluation. I hope uh, whatever the your doubts and confusion, that will be helpful for you, or I will clarify your doubts. So thank you all. If you have
Thank
any
you, ma'am.
queries, please ask.
Thank you, ma'am. Thank you so much. Uh, I will ask all the participants to please, if you have any query or questions, please write them in the chat box, or you can ask by unmuting yourself.
Sonali ma'am,
Yes, ma'am.
could you please describe about the OSPI method, because many of us are not aware about the OSPI regarding gastric lavage or CPR you had included in your last but
Oh.
one slide.
Okay. OSPI, in OSPI, there is this, 1 minute, I will share 1 minute.
उसको करवाना कैसा है, अगर ये बोल देते तो यूजफुल हो जाता मैम.
Actually, for the OSPI, ma'am, there is the number of faculty. Faculty ज़्यादा चाहिए, station चाहिए, infrastructure चाहिए. तो what we are doing in our colleges, as the number of there is constraint of faculty and all those things, तो हम क्या करते हैं, modified OSPI लेते हैं. Student has to come to one station, means in OSPI there is n number of station and student has to go that station, particular station, and there is the facilitator or supervisor is there, जो note down करता है कि whether student has done this procedure or not. For example, Rayleigh's 2 RT insertion for the gastric limb. So RT insertion, when students come to the first station, there is specific artery is the how and that Menkins also. So how that RT is inserted. So before proceeding for the RT insertion, whether he measure the length of that RT, how it to be inserted, and that will be supervised by that particular faculty in every station. But it is not possible. This 7 स्टेशन है और 7 स्टेशन में हर एक स्टेशन में हम लोग सुपरवाइजर रखे. So basically
Hello.
Yes, sir.
Hello, am I audible?
Yes, sir.
संतोष सर वो rejoin कर रही है मैम ना. We'll wait for a few minutes. Ma'am will
Sure.
rejoin us.
Sure, ma'am.
Until ma'am rejoins, I would like to bring to all of your notice that the first sessionals, I guess all of us have completed the first term test, sorry, of 100 marks. And this has to be given weightage. The way we frame the questions, what is must to know, what is desirable to know, what is nice to know. There are 3 different patterns. We should see that also. And we should see how much question weightage is being given for each topic before we frame the questions. I have heard of certain instances wherein students are very particular about this blueprint. They know better than teachers. Exactly, they know better than teachers. There are many incidences which have come up during the first year examination, first professional BMS examination, where teacher was not aware and routinely, for example, in our case also, routinely we ask questions like define abortion, types of abortion, criminal abortion or therapeutic abortion. But now we should remember that no long questions can be asked on this topic because it is avoided in the blueprint, and students exactly learn the blueprint before they learn for examination. So they know that what questions might come from what topic and they prepare accordingly. So as teachers, when we frame the question paper, I have known of incidences where RTI have been framed against the question paper setter, and the setter has been banned from the examination schedule for 2 years, 3 years. Such things have also happened because he was at fault. So maybe from legal point of view also this becomes important. So any doubt regarding, madam will join us soon. If you have any doubt, we can go back and see the blueprint once again, maybe if many of us have not seen it in the syllabus. Due importance has to be given to this. And before we make up the final examination, such things in term test we can still manage. But for the final examination, we should be clear on what should be asked and what should not be. This recording will be given, will be shared in the NAG group. So let us go back and listen to this madam's talk once again and see the weightage, see the slides before we are, and get thorough regarding the questions that has to be framed from which topic.
The mankins in our department, there is the mankins of for the RT insertion and gastric lavage. And yes, in our institute, the SVL lab is very established and very much fully fledged SVL lab. So if anyone wants to come or visit to our SVL lab, so please, you are most welcome, all faculty. कि वहां पर हम लोगों ने मैनकिन्स बनाए हैं एंड देन द आरटी इंसर्शन वी हैव मेक द चेकलिस्ट ऑफ द हाउ द आरटी इज इंसर्टेड that 10 marks checklist. I think I have also shared that OSCE checklist to some of the faculty. So while inserting the OSCE, what student is first step, what he has to do, how he measures that step-wise marks is given. Okay, proceed. OSCE means क्या है? Objective Structure Procedure Station. ठीक है, स्किल एडॉप्ट करनी है, ना कि ऑस्पी ले ली और बस ऑस्पी इंसर्ट कर दी, नहीं। हमें उतनी प्रोसीजर, हमें वो चेकलिस्ट बना के वहां पे देखनी है कि वेदर ही इज डूइंग द प्रॉपर लेंथ, वेदर ही इज डूइंग वेयर द ग्लोव्स, वेदर ही इज डूइंग द lubrication to the that RT, and how he insert that RT. So all these checklist is given, and according to we perform the OSPI in our department. Yeah, there are response station and practical station for the OSPI. So this is the practical station for the RT insertion. But if there is no mannequins and no that, so in that case you can ask about only the response station. Means some of the plants or poisonous plants you can place, and you can, or one of the models like the mummifications or hanging models you can place, and you can ask the 5 or 10 questions depending on the mass distribution on that topic. So how many weightage means if you ask the 5 questions on that particular specimen or models, ki what are the condition required for the mummification, or what is the factors for the mummification, so what are the characteristic of mummification, so that also included in this, that is the response station. We call it as the response station. So that you can do in your museum also, that type of hospital. Is it okay?
One more question is there, ma'am, from Dr.
Yeah.
Sarin Sultana.
Uh-huh.
In regarding the skin cases, which conditions should be given importance?
Skin conditions. Okay, we can take the cases of the contact dermatitis. जिसे हम लोग ये स्पेसिफाई नहीं कर सकते सर कि यही स्किन डिसीजेस हमारे, yes, skin OPD is allotted to Agad Tantra department, so we can take the whole number of cases, no? When we see the history of the chronic skin diseases, there must be the history of the Viruddhar and Garvish or Dushivish types. Some of the history we got it. So don't specify कि यही skin disease मैं लूँ क्या और ये नहीं लेना चाहिए क्या. Don't do this. That comes under our area. Ma'am, your voice is breaking. Hello.
हाँ, इस शोभा मैम, आप कुछ कह रहे थे क्या?
नहीं नहीं सर, मैं नहीं
हाँ,
बात कर रही थी,
हाँ,
कोई और था।
हाँ, हाँ. So we have already actually crossed our stipulated time, and I know there are many questions and doubts. So, but due to